Very, very well. Luc Maillard, pleasure to meet with you. You are from Clinique Axiom in Aix-en-Provence in France. And we are doing now this delayed interview because we could not meet at the EuroPCR. We have known each other for a very long time. You've been very instrumental in all the developments and applications also of the QFR. And you are also the first recruiter now for the FAVOR3 trial with the latest number that I have, 164 patients. And of course, we have hopefully only 1 month to go before we have all the 2,000 patients in. So that will be a milestone also. And thanks very much for your support in the FAVOR3 trial. And with that, of course, congratulations. And I mean, you will be one of the first authors, or at least in the forefront of the paper that will be published, I hope, next year.
Hello, Hans. Nice to see you again. And thanks for the very nice word.
Yeah, and we have discussed that at earlier occasions also. You are not only doing the science, you're enrolling for the FAVOR3 trial, but you're also using the QFR in your daily practice. And can you say something more about how do you use it? Is it pre-PCI, post-PCI? Do you use, for example, the residual QFR in diagnostic cases? I would really be intrigued how it works in your daily clinical practice and not only the research practice.
This is a very good question. The QFR is included in routine for all applications. This is a very good help for decision. For diagnosis, patients that come with no documented ischemia, to document it also lesion, excepted the acute for MI or unstable angina, and to evaluate the other lesion. And this is an help for the result in complex lesion or complex patient, post-PCI, to evaluate the final flux. This is very good tool also for multivessel lesion. This is an help to choose the lesion that need to be treated or to orient the patient for the surgeon if needed. And the tool is included in the routine for all application, pre, post, during PTCA, and for decisions. It's very good tool to help. And we learn many things, very important things, especially for intermediate lesion, non-calcified lesion from the LAD, by example. You say there is no significant lesion. In fact, you have a very good impact of ischemia on very important to make a simple routine evaluation, especially if you make sample acquisition, good acquisition, prevent overlap, you make a fast, safe, and easy analysis of the long segment you want to see. So that's very important, very good help for every time.
Yeah, that is, of course, I mean, you have such a routine now that image quality is, of course, very important. If you have good or reasonable image quality, then the analysis will also go simpler. You have to do less interactions, and that makes life only easier for your practice. And are the technicians doing all the analysis, or do you do that, or how is that organized in your cath labs?
To win times, all my technicians have been formed and are ready to perform the analysis. In fact, if the physician knows how to make the analysis, it can improve the quality of the acquisition. So it makes it much more easier, the analysis for the technician. And you can repeat it with 1, 2, 3 operators, and you can check the feasibility and the reliability of the results. That's very important. Make it fast, safe, and easy for everyone. And you have a very good application in this case. That's very important.
Yeah, and of course, now with the new versions that we have developed, the analysis will only be simpler and faster also, so that there's less interactions, and it's also for the technicians a lot easier to work with it. and do not require extensive training and certification and so on. So for the FAVOR 3 trial, you're still using the previous version 2.0, but of course, in the meantime, we have come, I think, a long way in further improving on the software and making it a lot simpler for daily clinical practice. So I'm sure that will suit your applications, your daily clinical practice also significantly.
The simplest way is the analysis. The better is the results for routine and repetitive application. So that's clear. That's clear.
Yeah, no, absolutely. Are you missing something in the analysis? Of course, we are also coming out with IMR for research purposes. I think that is also in important, say, parameter.
For IMI, evaluation of the other lesion is very important. So if there is no significant other lesion, the patient is still get out at 3 or 5 days, and it's just medical therapy. But if there is other lesion, in routine, we plan to make the other lesion at 1 month after stabilization. So
yeah,
that's a conventional way of treatment.
Yeah. No, but I mean the IMR, the index of microcirculatory resistance. Is that something that comes frequently, is a frequent issue in your practice?
In fact, yes. In fact, yes, because there is quite numbers of fields, patients that present typically angina, but with no lesion. So that's important to evaluate the macrocirculation and to find the good medical therapy. That's important because you have a diagnosis, and before we have no diagnosis. So and that justified the medical therapy, and you can make an evaluation. So that's very good, very important.
Yeah. So those are the INOCA patients, as they call it.
Yeah.
Yeah.
Especially young women smoking. That's the good application. So that's very important.
Yeah. So that is also one of our next steps, or at least working on that already, and moving that hopefully soon towards say a clinical solution also.
Yeah. So if you can include the CFR cardio flow reserve, that will be very nice.
Yeah.
Sure.
Yeah. No, fantastic. And I remember also from previous discussions that you say with the QFR in your routine practice that it saves also time in the cath lab, and that there is less overtime by the nurses, by the technicians, right?
Yes, because over the technical and scientific aspect of the FFR, you have to prepare tools, and there is some derivation. And I feel much more comfortable with the QFR than the FFR. And in fact, I'm using FFR only for scientific aspect now, or studies, but I'm much more comfortable with the QFR on the way of work. I find it much comfortable, much easier, and I'm good with this. Sure.
Yeah, no, very happy to hear that. And there is nowadays also no distinction in terms of reimbursement and in France anymore, right? The wire is not reimbursed, QFR is also not reimbursed, but it's now, I think, all to be covered in the total package for the cath procedure. That is where it has to be paid from, I suppose.
This is a European problem, reimbursement of medicine. That's really complicated. We have a good tool for new application, how to select in a better way the patient, and all the political boards are trying to make some economy, and that's really difficult, I know, to make and to use such kind of new improvement. But unfortunately, we don't have a lot of push on that, whatever the we've made with the French Society of Cardiology and so on. So that's Oh, well, everywhere in Europe, I know.
Yeah, no, absolutely. Yeah, certainly. Yeah, that's absolutely a big issue. And yeah, I hope that at some point in time also the situation there will change, of course, so that reimbursement or a good total, say, coverage of all these costs by the government is and by the insurance companies is established, is realized at some point in time.
Yeah, sure.
By the way, are you coming to the ESC in Amsterdam?
Yes, I plan to do it. So we'll have the opportunity to meet and to discuss much more longer. Sure,
Yeah,
with pleasure.
absolutely. I mean, we have seen each other. I think it was last year also at PCR 22, but it will be very good to see you again at the ESC in Amsterdam, which is, of course, for us very easy to to reach. Only 20 minutes by train from Leiden, where we are with our company. But I
So,
certainly look forward to see you there.
yeah, sure. But if you have the opportunity, you're welcome in Aix-en-Provence, just to have a few days for discussion, work, and new application, as you know.
Very good. Yeah. Well, thank you
You're
very
welcome.
much also for the invitation. And I would like to thank you very much also for this interview and update on everything what you're doing with the QFR, and look forward to the next round of discussions with you.